Good evening, Jubilee. My name is Nondu, and as Kate said, I'm going to be heading the spotlight this evening. We get an opportunity to draw your attention to some of the ministries that the church hosts. And some of you may not be aware of these, so this isn't a great opportunity for you to find out how you can get involved, and hopefully this will inspire you. So we have our guests, Rachel and Bongiwe. Welcome them up as they join me on the stage. Good evening, ladies. I'm so excited to interview you. Thank you so much for joining us. Okay, so let's get started. Can you tell us, how long has the clinic been around for? How did it start, and how did you two ladies get involved?
So believe it or not, the clinic's been around for 17 years. So those people who don't know where it is, it's actually behind us in the bottom of the building. So you get to it by coming around to the car park. So if no one's seen it, that's where it is. So it's been running for 17 years, just as a response from the eldership and a prophetic word many years ago, 20 years ago, to reach out to the community in health and to react to the HIV and AIDS pandemic, really. But we run a primary healthcare clinic there. So I'm a paediatric nurse, a children's nurse from the UK, and I've always wanted to serve God abroad, whatever that meant. Little did I know that he would send me abroad long term, but it was quite an act of faith for me to come, and then a trusting journey of you really want me here in South Africa and to help set up the clinic. So it's been an awesome journey.
Awesome. Can you tell us your story, Bongiwe?
Good evening. So good evening, Judge. So when the clinic was beginning 17 years ago, I was being saved in this church, and then I joined 2008. Yes. So I responded to the invitation from the bulletin from this church that was offering a HIV and AIDS training. So that's how my journey to join the clinic began.
Awesome. Thanks, guys.
And she is an awesome counsellor, can I just say that?
Wonderful. So the clinic is in a church building, as you pointed out. Some of the patients that you see here, do they have some sort of religious background or not? Is prayer part of the consult? And if it is, how do they respond to it?
Yeah, when I saw this question, the phrase, all tongues and tribes and nations, that's who we see. So they see that they're walking into a church. But the beautiful thing about the health centre is that people feel safe when they come in. We offer them tea and coffee, and then they ask for food, and we say we don't do food. But we treat people with dignity and respect, and I think that's what makes people safe. And yes, we do pray for them. That's been the passion from the beginning. As a nurse, you can go so far and then you think, I am helping this person, but I'm not like eternally helping this person. So to pray for them means that they, sometimes they end up in tears, or a deeper healing comes, because when you you'll know as a doctor, when you actually pray into and talk to someone about what is actually wrong and why they've got high blood pressure or why they're stressed out, then the healing comes. So people respond really well. I'd say 99% of people say yes and respond really well to it. And then we see answered prayers as well. And then we want people to remember that they came and met God, not what the name of their nurse or doctor was. We want them to encounter God. And a lot of people do that. We've got counselling running, physio, occupational therapy, did I say counselling? And medical consultations. So we have a passion for people to meet with him. That's really why we set it up in the first place.
Well, that's great. The church is a place for everyone, and everyone can come as they are. That's awesome. Okay. What are some of the challenges you guys are facing in the clinic at the moment? And of course, we also want to hear about the highlights and some of the testimonies.
So I would say that one of the challenges would be the amount of people that we're having to see with the staff that we have. So you can probably tell, but we want to spend longer with each person. So in the day hospitals, it's very hard for the doctors because it's like 60 people get through them in 4 hours or something, and you can spend very little time. But we want to spend lots of time to holistically care for people. So one of our biggest needs is more staff or more volunteers. Medical professionals would be wonderful. Other volunteers would be wonderful to pray for people, etc. But that's one of the big challenges, is that some people wait 6 hours or something to see us. And then the clientele that we see, some people, we see a lot of refugees and have employed people that speak French, Lingala, Swahili, etc. And then the abject need of refugees is and some people in these communities that live around here. Our catchment area is enormous, the whole of Cape Town, because people hear of what we do and want to come. And so I would say a challenge is psychologically, and us relying on God to say, you will meet these people's needs. Otherwise, we get this saving mentality of, I've got to help. But actually, when we pray, God absolutely comes through for many people.
Maybe you can mention some of the highlights. Thank you.
I think the biggest highlight for me is that Jesus is who he says he is, and that he is present. He said he's ever-present help in time of need, and that is true, even in a practical, everyday life of meeting with people. So as Rachel has said, we see in a very broader referrals. And I think the highlight that came to mind was recently coming in contact with a lady who is actively involved in rescuing people who have been trafficked to South Africa. And seeing how God had lead them to rescue these ladies, and how God provides. And sometimes we chatted with a lady who was rescued, I think from Thailand, but she couldn't speak any language that we understand, and God provided the way that we can communicate. It seems so small, but God is involved in our lives. God is involved in every small details of our lives, and he is coming through for us all. I think the challenge, to add to what Rachel is saying with the challenge, is having so much demand, and sometimes we are unable to meet, or people have to wait for a little bit longer before they are met and seen. So value prayers there. We have grown. The counselling in the health centre has grown so much, but we still need more from male. We need more male counsellors to just come along and be available.
I think one of the wonderful things, because we've been in the community for so long, is relationships built. I think a bit like being a family GP service, we build a relationship and see someone have a baby, and then that person have a baby, and etc. And also having lots of healthcare professionals under one roof at one time. We have the privilege of looking after a little girl who's 9 now, who got severely burnt about a year ago. And when she came out of hospital, the mum was a former patient of ours and brought her along. But what has been the joy is to be able to actually help this family in some counselling for the whole family, in burns treatment, in medical care and physiotherapy and occupational therapy. And this child will never be the same again. So that's the joy of having people volunteer with us, is that we can offer those services and we can actually change the trajectory of people's lives, because, and some of those professionals have links in with the state system. And so to be able to arrange things and holistically care for people has been incredible.
Yeah, those sound like really powerful testimonies. Thank you for sharing that. It's great to see how God is at work in the church, and obviously for people who are believers and for people who are non-believers as well. I remember when I was a medical student, I did my elective at the clinic, half of my elective, and what struck me the most about that is how Jesus was just so present in the workplace. And I think often when we are in our own workplaces, that's not something that happens as well. So I feel quite encouraged working at the clinic and being able to, to be able to do that in my own workplace. So I think we are running out of time, but I do have one more question for you. What vision does the team have for the clinic in the next 5 to 10 years?
We all have a passion to see, Jesus impact lives. So I would say that on a practical level, more people working with us would mean that we can be open longer. So we're 5 days a week, because at the moment it's counselling 4 and medical 3 days a week. So I think that would be a practical thing. And then I'm going to get in there now, but we really want people to come and see the work that we're doing. Because if you have a passion to pray, we have a passion to see Jesus meet people. So whether you be a healthcare professional with some time, or someone who wants to pray for healing, I brought that word tonight about a miracle-working God who can meet people. Come pray for people. We're very open to that, so yeah.
Is there something you want to say, Wangiri?
I was not going to say something. Just you invited me. So just to add to what Rachel is saying, that to see lots of people being saved, and also to see to have people who are passionate about God come alongside and minister. And part of the counseling that we do, I would like to see that multiplied. So literally have lots of places or satellite places where there is so much counseling happening. And I've seen a little bit of that already. And being Jubilee having to have a biblical-based training counseling, thanks to Kyle and Sam and everyone else who's involved. And it's such a privilege to be able to use the truth of God and the Bible into ministering to people. And having to meet with so many people outside from Jubilee, you hear sometimes the horrendous of treatment, sometimes from the church, but actually to see quite a lot of satellite of what we're doing. When I first started to the health center, I worked with Rachel, Karen, and Glenn, and their highlight or their priority was to serve God and to honor people. The culture of honoring one another and caring for one another, and being rooted on the truth of God, no matter what. So to see that, also like there's quite a young people tonight. I always come in the morning. I feel so old when I'm here. So, but also to see Christians, especially in this young age, being set out to honor God in their workplace, in whatever they've chosen for, to be the representative of God with unwavering. I promise not to say so much now. I'm thinking, talking too much.
I think that's going to be the end of the interview. But thank you so much for coming out. Thank you for sharing. Thank you for your time. Feeling very inspired by your love for the clinic and your love for Jesus and for God's people. And I hope some of you are feeling inspired as well. And if you are looking for an area to serve, as Rachel has said, there is lots of need. Maybe come chat to Bongiwe and Rachel after the service. So that's it for me. Thank you, everyone. Let's all give Rachel and Bongiwe a round of applause.